Hello, and thank you for joining me today. My name is Kimberly Beeler, and I am the WCIF Account Executive working with Island County on the 2021 open enrollment benefits. So today we're going to look at all of the plan options that you have through the county. The great news is the plans are rolling over from 2020. So if you're familiar with what you have and you like what you have, not a lot of changes, but there are a couple of plan enhancements that I'll touch on. And today we're going to be going through each of those plans in at least some detail and then going over some of the options that you'll have for 2021. So we'll go ahead and get started. First off, a quick disclaimer. I already mentioned this, but this is going to be a brief overview of all of the plan options that you have. There is more program detail available from your Human Resources Department or by going to WCIF.net. To kick it off, we'll start with PREMERA Blue Cross, which is the medical plan carrier. PREMERA Blue Cross plans are offered with the Heritage Network, which is PREMERA's richest network. There aren't any new benefits, however, there was one minor change, which we'll touch on in just a little bit. So for the most part, these plans are the same as they were in 2020. You still have the option of the WCIF 5000 plan or the WCIF HSA 3000 plan. Now these plans are very different in how they operate, and I'll go into detail about that. One thing to note too, they are also offered with an additional benefit offered by Island County. So what I'm talking about right now is the plan through PREMERA specifically. So if you called the 800 number, the 877 number there at the top of the screen and asked PREMERA what you had, this is what they would tell you. So those additional benefits through the county we'll cover here in just a minute. But the benefit itself on the 5000 plan, it has a $5,000 deductible, which has a matching $5,000 out-of-pocket maximum. For a family, it's 2 times that. So essentially how this plan works is, let's say you're hospitalized and you rack up a bill over $5,000. Under this WCIF 5000 plan, you would be responsible for the first $5,000 of coverage, which would get you to your out-of-pocket maximum. Once the out-of-pocket maximum is hit, then PREMERA pays 100% of the cost of eligible benefits through the rest of the plan year. The plan year runs January 1 through December 31st every year, so it runs with the calendar year. One thing to note with the out-of-pocket maximum and what makes it different than the deductible is that the out-of-pocket maximum includes both copays and deductible. So if you happen to go to a doctor's office visit and you pay a $35 copay, that's going to start to accumulate towards that annual out-of-pocket maximum. So it's possible to pay your out-of-pocket maximum either through deductible only or through a combination of both deductible and copay expenses. Pharmacy benefits on this plan, the copays themselves are not changing. $5 copay for generic, $35 for brand, and $70 for the non-preferred. So that's kind of the more traditional, straightforward WCIF 5000 plan. The other plan option, what's different about this plan is that it is considered an IRS qualified high deductible health plan, which means it's eligible to be offered in conjunction with a health savings account. Now, again, we'll talk a little bit more about the health savings account in a few slides, but here's how the plan in and of itself works. This plan, if you enroll employee only, so no dependents, you have a $3,000 deductible. If you enroll any dependents, the family deductible, the aggregate family deductible is $6,000. So let's say that same situation, you go to the hospital. If you're enrolled employee only, you're going to pay the first $3,000 right off the top of that bill. That's your deductible. Then the remaining amount is going to be split with the insurance company 80-20. The insurance company will pay 80% and you will pay 20% until your deductible, that $3,000, and the 20% that you're paying equals a total of $6,000. Once that $6,000 is met, then the plan is going to pick up 100% of through the. What's unique about this plan is that unlike the 5000 plan where you have flat dollar copays for things like office visits and prescriptions, under the HSA plan, with the exception of preventive care, which is covered in full, all services are subject to the deductible first, then you split the bill with the insurance company. So your out-of-pocket costs are much higher, but there is a trade-off with some advantages, which we'll cover here in the next few slides. Virtual care. So I did mention there was one minor change to the 5,000 plan. On the 5,000 plan, the virtual care vendor copay is dropping from $10 to $5 in 2021. So a reduction in the cost for virtual care vendors through PREMERA. If you're on the HSA 3,000 plan, though, your virtual care cost share remains deductible and coinsurance. So keep that in mind, that virtual care is available to you. PREMERA has been working quite diligently this last year to enhance their virtual care options. If you haven't used a virtual care vendor in the past, I encourage you to take a look at it at PREMERA.com. Great way to save money, regardless of which plan you're on. Your cost shares are going to be much lower through virtual care than they would be going to a standard primary care provider or urgent care facility. Obviously, it's not going to be applicable in all situations, but there are quite a few things that you can handle through virtual care, and I encourage you to try it out. All right, so I mentioned that the county provides some additional benefits to complement the medical plans. So this first one is called the Health Reimbursement Account, or HRA, and this plan pairs with the WCIF 5,000 plan. Now with this plan, it is a reimbursement only plan, meaning that if you don't incur expenses through the medical plan, the county doesn't pay out. However, if you do have those expenses, then the county will pay on a reimbursement basis, meaning you'll have to submit your claim forms, your explanation of benefits to the company that's administering this, VIMLY Benefit Solutions. You can submit those claims by email, fax, regular mail, or through the online system in Simon. You do have to provide substantiation for those claims. So what that means is that it has to be an itemized receipt or an explanation of benefits. They have to be able to see that this was actually an eligible expense under the medical plan and that it was paid for you. So they need to see what it was. But what's great about this is that the county will pay up to that $4,000. So if you're an employee only on the plan and you let's say hit that out-of-pocket maximum of $5,000, the county is going to contribute $4,000 of that $5,000 through this HRA account. So your total liability is about $1,000 after county contributions. So really great plan there. For those of you with a family, a little bit different, but also a great benefit, the county will contribute up to $6,000 towards the family out-of-pocket costs. So on the family out-of-pocket maximum, it is $10,000. So you have a little bit more responsibility on your end. If you did max full family benefit, you would be responsible for the remaining $4,000. But that, again, is if you hit that annual out-of-pocket maximum. For those of you who have, a couple doctor's office visits a year, maybe a prescription or two, you may not even get to that full $4,000 or $6,000 mark, meaning that the county would pay basically all of the outstanding costs that you had through the plan. So really great benefit offering through the county. Very, very great benefit for you as an employee. Please be sure that you do use the HRA if you are enrolled in this WCIF 5,000 plan. All right, next move to the HSA, the Health Savings Account plan. So while the HRA, the Health Reimbursement Account, was a reimbursement basis, this is a savings account. This savings account is owned by you, the employee. Any money in the health savings account is owned by you. It's not held by the county. It's your money. It's your health savings account. Island County will contribute for an individual self-only coverage, employee only, $2,000 every year into an HSA account on your behalf. You as an individual can elect to contribute more up to the IRS maximum, which for self-only coverage is a total of $3,600. And remember, Island County is contributing $2,000 of that, so you could contribute an additional $1,600 if you chose to max out that savings account for the year. The contributions are contributed to that HSA account on a pre-tax basis, so you don't pay tax on the money that you put into that HSA account, and it rolls over year to year. It's your money, your funds you keep, and you can use them not only for health expenses, medical expenses, but for dental, for vision, for any IRS Section 213D eligible expense. So really great way to put some money aside on a pre-tax basis, and the county has that very generous contribution. For a family, the county will contribute up to $4,000 of the annual contribution limit, meaning that you can contribute an additional $3,200 if you elect to do so. Also, for both self and family coverage, if anyone is over age 50, you can add an additional $1,000 catch-up contribution. So that is the health savings account. For anyone who happens to be at age 65 or will be turning age 65 in 2021, and you're looking at the health savings account specifically, please make sure that you check with the county, because Medicare does have some rules in place, and so you should be aware of how to structure that, just so that you don't lose the opportunity to contribute to an HSA account. Skipped over one slide there. All right, dental. There are 3 dental plan options available through the county. 2 are through Delta Dental of Washington. Delta Dental allows you to choose really, as long as they're a licensed dentist, you can go see them. So there are different levels of dentist. There's PPO, Premier, and non-participating. And so you'll see each class has a different reimbursement amount. With a PPO provider, Delta has negotiated the lowest rate, so you will always pay less seeing a PPO provider. They've negotiated rates with Premier dentists as well. Non-participating dentists, they don't have an agreement with, so you can be balance billed. You could end up paying more. It really just depends on the provider. So you've got the option with Delta of the base plan, which is a pretty minimal benefit, but it does provide you some coverage. Or if you'd like some additional coverage, then you can buy up to the buy-up plan. One new benefit on both of these plans for 2021 is that posterior composite fillings will now be covered at the same level as amalgam fillings. So what that means is the tooth-colored filling on the back teeth is going to be covered the same as the silver filling now. So that's new for 2021. The other dental option that you have is through Willamette Dental. With Willamette Dental, the difference is you have to go to a Willamette Dental facility in order to seek care. However, the trade-off is there's no annual maximum, meaning you can have as much care as you need in any given calendar year. There's no upfront cost, so no deductible, and most of your general visits are going to be covered under a $10 office visit copay. So really great benefit. There's a really great orthodontia benefit as well for both adults and children. It's an $1,800 copay. And also new in 2021, Willamette Dental specialty offices will begin covering implant surgical services. So that's new. If you've got questions about that benefit, please reach out to Willamette Dental. There's a customer service number there at the top, or you can go to willamettedental.com. For those of you who may need glasses or contacts, there is a voluntary vision plan through VSP. One new benefit with this, if you're on the plan and going to keep it, just know that Walmart and Sam's Club are going to be added as a provider, and they work the same way that Costco currently does. So Costco right now has a $95 frame allowance, and that's going to be applied to Walmart and Sam's Club starting January 1, 2021. Talked a little bit about the health reimbursement arrangement and the health savings account. This is the flexible spending arrangement. The flexible spending arrangement allows you as an employee to set aside money up to $2,150, and that's a 2020 limit. 2021 has not yet been released by the IRS. You can set aside money, any amount up to that, so you can choose less if you want, and you can set aside those dollars on a pre-tax basis to pay for any Section 213D eligible expense, and that is a very large list of items. New this year, the over-the-counter medications, which previously required a prescription to be eligible, that's now no longer required, so you can purchase over-the-counter medications through the flexible spending arrangement. Also, feminine products will be covered under FSAs moving forward as well. So a lot of different things, Band-Aid, sunscreen, lots of different items, and there are a lot of different vendors like Amazon or FSAstore.com where you can find out what types of items would be eligible. So there may be everyday items that you're using already that you could be setting aside pre-tax dollars to purchase those items. So definitely look into that if you have an opportunity. The other arm of the flexible spending arrangement is the dependent care account program. So if you have dependents that you need to pay for care for them, you can set aside up to $5,000 per household every year for the care of those dependents. If you need additional information, please reach out to flexspending@vimly.com, or you can call their customer service number. You can also check with HR. First Choice Health EAP. You have an employee assistance program through the county, and this is an incredibly robust program. There are so many resources available to you at firstchoice.com. If you're looking to make a will, if you need some financial resources, if you want to do some training, maybe you're thinking about moving into management and you want to be prepared, you have so much available to you at firstchoiceeap.com. Definitely encourage you to check that out. You also can access First Choice Health anytime at 800-777-4114. From that number, you can ask for face-to-face counseling services for a variety of issues, and not just for you as an individual, but for you and your family as well. You have work-life resources, so if you need help with childcare or elder care, if your ID's been stolen, EAP has resources for you. It is a 100% confidential program. Nothing gets reported back to your employer through this EAP, so if you do give them a call and you need some help, really any area of life where you might have stress, there is a solution very likely through the EAP where they can help guide you. So definitely encourage you to take a look at that. The EAP program is available to employees, all of your household members, and children to the age of 26. In addition to the in-person counseling, you also have the ability to access counselors through the online platform BetterHelp. So in order to access this, you would need to download the app BetterHelp, and then you can give the EAP a call and they'll get you hooked up so that you can access the program for up to 6 sessions, which is 6 weeks on BetterHelp for free. So really great program available to you. The county also provides some additional benefits for life insurance. So each employee has a $24,000 policy that the county pays for on your behalf. They also pay for a $1,000 basic life dependent benefit for each of your eligible dependents. With that life insurance benefit, there are a couple of other services. I do want to point out that the travel assistance benefit as of July 1st is now through a company called Assist America, and there's more information about that program in either your employee booklet or through HR. Please, please, please be sure to review your beneficiary designations. If you do nothing else this year, please make sure you're not making any other changes. Please make sure that you know who your beneficiary is. You as the employee get to name the beneficiary for that $24,000 policy. And then if you choose to buy additional coverage through voluntary term life or through voluntary AD&D, you can either name the same or separate beneficiaries for those programs as well. The online enrollment system, if you are going to make other changes, does have a section for you to update your beneficiary through that online enrollment system. If you need additional information or would like to look at rates and plan information, you can ask HR for a copy of the benefit booklet or find it at WCIF.net. Long-term disability. The county pays for a base long-term disability plan for eligible employees. The base plan has a benefit waiting period of 180 days and covers up to 40% of your pre-disability earnings. You do have the option to buy up, and the buy up shortens the waiting period from 180 down to 90 days and increases your monthly benefit from 40% to 60% of your pre-disability income. Again, if you're interested, please check with HR. They'll be able to provide you the benefit booklet that has more benefit details as well as the rates. We also have a short-term disability plan available. voluntary products through MetLife. So these are what are called WORKSITE products. They are additional policies that you can purchase. One is for accident insurance, one is for hospital indemnity, and the final is for critical illness insurance. Each of these policies have essentially a high and a low option. The low option is about half of the cost of the high option, and the benefits pay about half of what you would be covered with under the high option. With accident insurance, if you have an accident, fall off a ladder, get a concussion, play in a sport, something like that, and you seek services, then you can submit a claim to MetLife, and all of the benefits through MetLife pay directly to you, the employee. So this is outside of your PREMERA insurance. This is outside of that HRA or HSA. These are reimbursements that come to you when one of these incidents occurs. So that's accident, hospital indemnity will cover you whether you're hospitalized due to an accident or to an illness. And then the critical illness insurance covers you if you receive one of the diagnoses that's covered by the plan. So this could be heart attack, stroke, there's a full cancer, partial cancer, Alzheimer's disease, a number of different things covered all in one package under the critical illness benefit. This one doesn't advertise as high and low. It's a $15,000 or a $30,000 benefit. So take a look at that. But HR does have booklets that cover all of these plans in details. They're really great value. Encourage you to take a look if you've been wanting to add some additional lines of coverage. I've mentioned WCIF.net several times, but just want to say one more time, if you need access to any of your plan information, please go to WCIF.net. Or if you're looking for some discounts on refrigerators, cars, rental cars, vacation destination activity, BENEFITHUB. This is available to you as a member with WCIF. Got some little information there on the slide showing you where to go on our website to find the BENEFITHUB Discount Center, and then the access codes are on the flyer there. Finally, the next steps, Simon ESS portal. This is a change-only open enrollment. So if you are making changes, you will want to log into Simon and go through the process of making those changes online. Please note, once you start this process, you need to finish it by electronically signing the document at the end. So it can take 10 to 20 minutes depending upon how much you're changing and what you're looking at there. But for the most part, pretty short process. You want to make sure that you can complete the entire process in one go. So do give yourself some time to look at this when you're logging into Simon. Once your change has been signed electronically and submitted, HR will take a look at it, review it, and if they have any questions, they'll get in touch with you. With that, I'd like to thank everyone for listening today. If you do have any questions, again, can't stress enough, reach out to Human Resources, or you can get in touch with me or any of the other account executives to answer questions at WCIF. Our contact information is available at WCIF.net. Thank you so much again for your time and hope you have a wonderful day.